The kidneys and bone, heart and blood vessel health. The kidneys do a lot of work in the body. They work 24 hours a day, 7 days a week to help keep you healthy. One of the kidneys' main jobs is to keep the bones healthy by balancing the levels of calcium, phosphate and vitamin D in the body. Calcium and phosphate are minerals found in our food and are the building blocks of bone. Vitamin D comes from our diet and is made by the body when our skin is exposed to direct sunlight. Vitamin D is needed for our digestive system to absorb the calcium and phosphate from the food we eat. Calcium and phosphate keep our bones and teeth strong and healthy. Our kidneys activate vitamin D, which means that without our kidneys, the vitamin D found in our diet doesn't work effectively. Healthy kidneys get rid of excess calcium and phosphate from the body through the urine. In people with kidney disease, phosphate can build up in the body because the kidneys can no longer get rid of excess amounts of phosphate in the urine. Over time, the calcium and phosphate usually found in the bones start to collect in the walls of the blood vessels. This causes brittle bones and stiff arteries. Calcium and phosphate can also collect in the joints and muscles. Brittle bones break more easily, and stiff arteries cause serious problems with the heart and blood vessels. In people with advanced kidney disease, high phosphate levels can cause itchy skin and bone and joint pain. Vitamin D levels are usually low in people with kidney disease, which also makes the bones more brittle. In people with kidney disease, damage to the bones, blood vessels and the heart that results from an imbalance of calcium, phosphate and vitamin D is sometimes called renal bone disease. We can check the balance of calcium and phosphate in the body with simple blood tests. We also check the level of a hormone in the blood called parathyroid hormone, or PTH for short. PTH is released from the parathyroid glands in the neck. PTH helps the kidneys, bones and intestines to balance calcium and phosphate levels in the body. PTH is often high in people with advanced kidney disease. You can check your blood results online and your kidney team can help you understand your results. Phosphate is found in natural foods like meat, dairy, eggs and nuts. Phosphate is also added as a preservative in processed foods like processed meats and ready meals, and is also in dark fizzy drinks. If your phosphate is high, your kidney dietitian will give you advice on how to limit foods high in phosphate and suggest alternative things to eat. Sometimes medicines are needed to stop phosphate levels from going too high. Your kidney specialist may ask you to take medicines called phosphate binders with your food. Phosphate binders trap phosphate from food in the intestines to reduce how much gets into the blood. We may ask you to take vitamin D and other medicines to help reduce the level of PTH in the blood. You may be prescribed a type of vitamin D that is designed for people with kidney disease. If you are having dialysis, it's important to do your treatments as advised by the doctor. Longer and more frequent dialysis is better at removing excess fluid, phosphate and waste products from the blood. This means that people having longer and more frequent dialysis have stronger bones and healthier hearts. People having longer and more frequent dialysis may not have to take phosphate binders and have more freedom to drink and eat more of their favourite foods. It can be difficult to stick to a kidney diet and to take so many medicines. If you're having problems with your diet, medicines or treatments, or if you would like to learn more, speak to your renal team or visit our website.